Our guest this week is Holly White, Project Coordinator improving children's mental health through school and community at HWBP.
The website to help increase access to different services throughout the county of Racine. And what we're seeing that most people are navigating, particularly during this time, number one is actually food resources. So food pantries, mobile market, food shelters, pick up at churches, things like that have been kind of the number one thing that people have been utilizing this website for, followed by mental health counseling, medication management as well.
Awesome. So can you talk a little bit about what the need is like, what kind of things you've been seeing with regards to how this year has changed things?
Yeah, so this website was developed in February of this year. So unfortunately, as far as like a data dashboard of what people have been searching, this website wasn't in existence prior to the pandemic. But a lot of what we're seeing is that the perception versus the actual reality of what is available for folks is a little bit different. There's a lot of perception that there are not these available mental health resources, that either people feel like their insurance isn't being utilized at that location, or all the spots are full. And what we're finding is that's not the reality, which makes a lot of sense, right? If I'm feeling depressed, I don't want to pick up the phone and call 9 places. That doesn't really sound like something fun that I want to do. So the reason that we developed this was more more quickly and easier, make it easier for folks to get connected to resources in the community, rather than like a phone book type of resource.
So kind of walk me through some of the components of the website.
Sure. Since we were just talking about mental health, I will go there first. So what we did was we created a pathway of 10 different providers that are located throughout Racine County. This website services the entire county. It's not just resources in the city, to mental health counseling and medication management. And like I alluded to before, rather than getting this laundry list of providers, I'm going to walk you through how you can very easily get connected to one provider without even picking up the phone. So if you go right here, it says, are you seeking a behavioral health provider? And click on this. So what we did is we have a partnership with 10 different providers throughout Racine County who, one, are taking clients, and two, take a variety of insurance. So this is for adults and children. You can do this for your child. You can do this for yourself. If you're a community provider and you have that person's consent, you can also do this as well. So first, it's just going to ask you, what are you looking for? So let's say I'm looking for talk therapy, and let's say I have state-funded insurance. So now these providers all take MA or state insurance. And so as we've worked on building this website out, the other thing we're working on is adding like a geographical component on the side here so that people can see how close it is. This is a new platform that this company Trilogy out of California had developed for us. And we are the first community in the nation to kind of put together this referral pathway. So there's still some room for improvement and some ongoing quality assurance. But so let's say I pick, we'll go here. So I know this person is taking clients. I know that they take my general type of insurance, and I know that they have capacity, right? So, and all it's going to do is you're basically doing a referral form. So if it's for yourself or for someone else, so you could do this for your child, just going to ask you some brief information. Who are you? If it's not for yourself, who's your relationship to the person? What are you experiencing? So we kind of gave people some general things that people are usually looking for counseling for, or you can just type in, I'm feeling really down. I know a lot of us are feeling a lot more isolated as a result of the pandemic. And so these places also do a variety of in-person and virtual options for counseling. And then it will just ask for the specific HMO for your insurance, and how can this clinic follow up with you? It's going to ask if you can leave a voicemail. So for example, if you are a survivor of domestic violence or sexual abuse and you don't want this person to leave you a voicemail, we have that as an option for you as well, and any other information that you want this provider to know. And then you send it, easy as that. And then you're going to get an email confirmation. Hi, you submitted a referral to professional services group. We will contact you within 2 business days. If for some reason there is a breakdown in communication, here's our phone number. And this whole referral form can be translated in all of these languages.
Holy cow, a lot of languages.
Yeah, so again, it's helping narrow things down rather than a broader list. You're connected to a specific place, and then that provider will follow up with you to get you set up in either virtual or in-person counseling, depending on what you're looking for and that individual clinic of how much of a ratio they're doing of either or.
So can somebody like schedule an appointment there too? Or is that something that they call you back for? And
yep, they will call you back. So that's when the phone comes in. The reason for that is one, this is going to like a clinic administrator based off of what therapists at that clinic have availability or what might be a good fit based off who you're looking for. So for example, if you are doing a referral for a 4-year-old, not all therapists see 4-year-olds.
right.
And things like that. So then they will match you with the best fit, and then they'll call you to set up an appointment.
So what about someone who's in crisis?
Good question. Also in that email will be, if you are actively in crisis, like i.e. you are currently having suicidal thoughts, please do not wait 2 business days. Here's the number for crisis. We also on our main page here, usually doesn't drag like this, I promise. So need help now. We have kind of the main numbers that we have identified for folks in Racine that can be very helpful. So we have the Hope line, the direct crisis line. Obviously, if this is a life-threatening emergency, call 911. The sexual assault crisis line is manned by volunteers 24 hours every day. So if you are currently in crisis, obviously follow up with a mental health care provider is very important. But if you are currently actively suicidal or homicidal, please call one of these numbers.
So are you guys seeing an uptick at all in the referrals or the use of these phone numbers, and how are we doing?
So I can speak in terms of, yes, we have had the number of referrals to mental health go up, but these entities are separate entities and I don't have access to their data specifically. So I don't want to misspeak on that.
Yeah, I'm sure it's pretty hard.
I'm sure it's up. Yeah. I would guess it's up. Yeah.
Yeah. So what else you talked about food, you've talked a little bit about domestic violence. Can you kind of go into a little bit more in depth of like, does it deal with where to get childcare? Is that a big issue? I literally had a teacher basically tell me she's got 3 kids of her own at home, and she's really struggling with, she's a single parent, so she doesn't have any backup and she can't really afford like childcare. So like, what does somebody like that do?
I wish I had solutions for all of the struggles that people are facing. It is extremely a tumultuous time, but also at a time we're all learning together. What we can help with, what we have here is these are all of the different areas of which we have resources. So childcare, for example, is on here that you could navigate through any of these things. So we have physical, mental health, basic needs. There also is a search bar up here that someone could just type in. And so there is expense assistance through here. There also is the child care sites, kinship care, hospice care, all of those sorts of things. There is Racine County. So I'm an employee of Professional Services Group, but Racine County is the fiscal agent for this grant that I operate. Racine County has launched a Here to Help initiative too, that they, if you call the job center, they can also, if you are more of, you want someone to walk you through over the phone versus navigating through the website, that's another option that people can reach out to as well.
Wow. Can you tell me more about the Healthy Wisconsin partnership a little bit?
I sure can. So, we're in year 5. So it's an 8-year grant that is through the Medical College of Wisconsin, through the Advancing Healthier Wisconsin Endowment. Racine is one of 10 communities across Wisconsin. You can kind of see this map here of different communities that were funded through this grant. All of the projects throughout these counties have some connection to behavioral or mental health, but they all have targeted different projects based off of the community's need. And so our award in Racine is focused on improving the social and emotional health of elementary school kids. So we work with the school district, we work with community partners to try to advance those skills, because one of the things that we found was there was social and emotional data of kids at the 4K kindergarten level. About 85% of them, according to Teaching Strategies Gold, which is the instrument that they use.
Say that again, because you kind of cut out a little bit.
Sure. Teaching Strategies Gold, they do it at the 4K level. It's basically an assessment of social and emotional skills of kids in that age group. So about 85% of kids in our county were meeting social and emotional milestones at that age. And then the next data set that really looks at that across the board is the Youth Risk and Behavior Instrument that starts in middle school. And what they were finding is that about 25% of kids had responses to questions that don't diagnose, but are basically a red flag for potential depression or anxiety. So we wanted to figure out what's happening in the interim, what's happening between the kindergarten, 5th grade time, where we're seeing such a difference in social and emotional milestones. So that's what this project is really geared at hitting. And in that award and doing some of that work, we identified these 4 strategies, one of which being improving the coordination and pathway to mental health services. And that's kind of out of that work group is where this website was born.
So you're taking a much more proactive rather than a reactive approach to a lot of these systemic problems that have been going on for a long time.
Correct. Yep.
Yeah.
Yep. Because we also know that, money and prevention, really for your return on investment is a lot of times a really good place for some dollars to be used.
Yeah. So this is the 5th year of the grant. How is it going?
So what we're finding is that we consistently have increased opportunities for parents to learn about SEL. We're finding that there are more things offered by the school district and other community folks that are more targeted in social and emotional learning. We're seeing that more things are being strategically implemented in the school, which is amazing. Huge shout out to Racine Unified. They have implemented a variety of different programs that are universal interventions for all kids, one of which being a mindfulness program called Inner Explore. And Racine Unified's implementation of this has been so successful that Inner Explore, the national company, is looking at doing a case study and highlighting the amount of usage that this mindfulness program has had. And then hopefully in turn, we'll be able to see that, see the results of that in the years to come. But this is our 2nd year of that.
That would be really interesting because actually, one of the things that I'm going to be working on is doing a lot of grant writing for solutions-based journalism projects around the education component to that. And you can hear my dog in the background, and I'm sorry.
Fine.
We just got a puppy, so that's one of those joys of being on Zoom. So when you're thinking about where we're at versus the need of the community, are we making some headway, and what kind of benchmarks are we using to accomplish that?
Sure. So I think we're at this stage where there have been more interventions put in place. So for example, this website, for example, like in the mental health space, trying to make it more accessible and trying to break down that stigma. So I think that's one component, but the other thing is I think that because we're in an intervention heavy time of putting these things out because we know that they're important, it's going to take a little bit of time to measure the impact of that. So I hope that answers your question.
Yeah.
It's a little too soon to tell. I think we're making a lot of good headway and I think that is one positive of the pandemic, which I hate to say positive of the pandemic, but that I think people are more apt to talk about mental health and struggling because, you know, we're all in this together. And I've been in a lot of meetings that, you know, most people would just, they usually respond, oh, I'm fine, everything's whatever. And I think people now, even just the simple, like, yeah, today's not great. This is my 8th Zoom call. My eyeballs hurt. You know, my kids have been screaming all day. My dog's driving me nuts. I think people are more apt to talk about how they're actually doing, which I think sounds like a small step, but hopefully between that and the interventions that are being put out there and the attention to mental health, hopefully in the long term, we'll see some benefits of that.
So what is the URL for the website again?
It is Racine County FamilyResources.com.
Racine County FamilyResources.com. Okay.
Yep.
So was there anything else that you wanted to add that maybe I didn't ask?
The only other thing is I just wanted to point out we have this, because Trilogy, the web developer for this, has implemented several government type resource mapping around the nation. They've compiled over 30,000 articles of really helpful information, anything from mental health, physical health, how do I know if I should maybe watch my drinking? There's a bunch of interactive tools, so like I'll show you one. And again, these are not to replace a mental health therapist by any means, but if you're kind of on the fence of, do I need a higher level of intervention, or I want more information on medication I'm taking, I don't understand what it's for, this can be a reliable place to look. So like here's an example where they're kind of walking you through questions. How much are you drinking? This is a standard drink. This has been a question that has been coming up often. I would not be surprised if we see around the nation a higher use of alcohol during this time.
Yeah.
And so we have a lot of different interactive tools that you can utilize to just flag for yourself if it's something you need to watch or get more assistance with. And then we also have there's a ton of great information by different health topics. A common one I get is, what is, quote, normal little boy behavior versus what's ADHD?
Mm-hmm.
So we have a lot of different articles on things you can look at. So here are symptoms, here's what to look for. In early infant care, there's some great resources for new moms. We have physical health information.
I can't imagine a new mom right now, because yeah, it's got to be, or having little kids, you know, where you're in that 4, 5, 6 years old and really struggling with, you know, having to do preschool or at home schools and things along that line. That's got to be pretty intense for mamas and the kids, and papas too.
Yeah, and I think, I mean, even you think of if someone had a baby, their first child, like in April, I have some people in my personal life that their parents haven't even met their kid. And it's because their parents are high risk or whatever else. And so just all of the implications of this, on the positive note, I do think that through different initiatives that are being put out, I think that they will definitely be helpful. But I also am realistic with all of the hardships that people are experiencing. Curious about what that's going to look like with time to come.
Yeah. So was there anything else that you think that people should know about the website, about any services that you guys are doing?
I just would encourage you to check it out. So I'm just going to, because I'm at a funky part in here, just so if anyone's watching this and wants to take a screenshot, this is the link. Really, it's very easy to navigate, and there is a search bar, so you don't even need to navigate it the way that I did. I would just really encourage you to check it out because there are a ton of really great resources throughout our entire county. And that I hope you all are staying as well and safe as you possibly can during this time.